Our reporting on the rebound Milwaukee, helping you manage the pressure to get back to work. For one man, it starts with surgery for a partially torn Achilles tendon. It was postponed because of COVID-19, and as he tells Sean Gallagher, he's not sure when he'll be able to get it fixed.
2.5 millimeters is all that's between Brad Hession and surgery. Right now, 75% of his Achilles is torn, but it's that other 25% that declared his surgery elective. And now he has to wait.
It was like lightning up my leg.
Brad Hession's injury happened while playing tennis in February. Now it's May, and he's been wearing this walking boot since mid-March after his surgery was postponed because of COVID-19.
If it's severed, it's not considered elective and they would do the procedure now. But because I'm literally hanging on, it is elective.
When I think of elective, I think of procedures where if they were postponed for a really long time, months and years, it wouldn't ultimately affect the patient's health status, like a cosmetic surgery.
Dr. Mark Kaufman with the Wisconsin Hospital Association says hospitals did this in an effort to protect themselves if there was an influx of COVID-19 patients.
By cutting back on elective procedures, you preserve personal protective equipment, the masks, the gowns, the N95 masks. You maintain capacity of ICU beds and ventilators. You keep your healthcare workforce safe.
Dr. Kaufman says surgeries fall into 3 buckets. True emergencies like an appendix that can't wait. The other end of the spectrum are elective surgeries like cosmetic procedures where it wouldn't impact your physical health status. Somewhere in the middle are necessary and essential surgeries like colonoscopies and joint replacements. Not immediately life-threatening, but can be if not treated. This week, Ascension, Wisconsin brought back elective surgeries at 25% capacity.
And as a general surgeon that I knew I could wait a couple of weeks to do, and there are others that I know from a symptomatic standpoint, from a clinical perspective, I'm not so comfortable waiting that long, and they're going to bring them in.
Brad worked at a polling place on Election Day. He says he can tolerate the pain and is okay waiting so others can get in first.
For heaven's sake, yes, the cancer people should go first. Whatever the doctors and the hospitals think in terms of priority is fine.
So here's the rebound rundown. Hospital systems in southeast Wisconsin are prioritizing elective surgeries. Emergency surgeries come first, followed by serious elective surgeries, and finally, cosmetic procedures. In Milwaukee, Sean Gallagher, TMJ4 News.